outset, I want to welcome you, all of you, coming this morning, taking your valuable time in attending this meeting. And I must thank Dr. Srivalsan and Dr. Anu, his son. He is also a senior gynecologist, having accepted our invitation to come and attend this meeting. In fact, when I asked him whether he can come, he said, I want to come. Then I asked him, why you want to come? No, because after surgery you are just recovering only. But he said, I want to let the public know that age is only a number today. So when he had this chest discomfort, he went to his cardiologist because then they diagnosed heart block, whereby the heartbeat will be less. As you grow older, the natural pacemaker on the heart will slows down, it gets diseased. So it is called the sick sinus syndrome, where the sinus node which gives the electrical impulse to the heart becomes sick due to the age. So they need a pacemaker implantation, that is the treatment. So usually, especially in older people with the borderline diabetes, we always do a coronary angiogram also, because he had chest discomfort. Then we found he had 4-vessel block in the heart. Now the question was where to do an operation or continue medical treatment or do an angioplasty. So angioplasty technically is difficult, especially in older people with the calcium in the arteries. So the best option was a bypass surgery and with the pacemaker implantation. So when we told him about the requirement of that, he said, whatever you say, I will decide. I will accept it because I know the advantage I am going to get. Only thing I am worried is about the pain. So I told him, don't worry about the pain. We make sure that you will not have any pain after the operation. So he will tell the rest of his post-operative course. But why I chose this case to present in the press is to get the people to know about the treatment available for heart disease today. And age is not at all a barrier in treating, provided the patients are willing. Because many times we, as senior experienced doctors and physicians, are doing a procedure. Today what happens, they will ask about 10-20 people, go through the WhatsApp information, WhatsApp doctor I call, and then they don't get the correct treatment. Each fellow will have a negative opinion that if you do like this, this will happen. Nobody will say, okay, you undergo this procedure, this is advantageous for you. So if anybody listens to a proper advice, only the beneficiary is the patient. You are the beneficiary. So in today's world, with so many, because I started cardiac surgery in 1977, when it was, the surgery was a very, very rare thing. In all India itself, there will be 2 or 3 centers doing open heart surgery. Now the surgical procedures, especially in bypass surgery, has advanced so much. I am fortunate to see the development which has happened, because olden days on bypass surgery, you have to stop the heart and use the heart-lung machine, take long hours. The results also were very poor. At least if you operate 100 patients, 25 patients used to die those days. Today, with the developments of technology and our experience with doing these procedures, a patient dying after bypass surgery is a news. Olden times, it was a patient surviving was a very big news. So much we have advanced, and especially in his case, especially older people, when we do the operation without stopping the heart, it's a big advantage because they may have, as you grow older, as you know, heart is not the only organ which becomes old. Your kidneys are old, your brain is old, your liver, all the systems are older. So they can have associated problems like sometimes you have liver dysfunction, kidney dysfunction, blocks in the blood vessels going to the brain, into the blood vessels in the leg. All those are possibilities.